Welcome to the LGBTQ Awareness Training, Advancing Treatment Skills for All Staff. Let's get started. E-learning and awareness. We have to be visible. We should not be ashamed of who we are. There are many of us out here. Sylvia Rivera. Training objectives. In this training content, you will learn how to understand key LGBTQ terminology and concepts used in this population. Recognize the impact of discrimination, stigma, and minority stress on LGBTQ individuals in recovery, and best practices for providing inclusive, affirming, and culturally competent care and applying trauma-informed approaches that account for gender identity, sexual orientation, and intersecting identities. Please click the button labeled Watch Video.
Let's go over some common LGBTQ terminology. Inquiring, do you know what cisgender is? Cisgender is someone whose gender identity matches the sex they were assigned at birth. It's essentially the opposite of transgender. Curious, what does LGBTQ stand for? The acronym stands for lesbian, gay, bisexual, transgender, and queer questioning. Explaining, non-binary. Non-binary is the idea that there are only two genders is sometimes called a gender binary, because binary means having two parts, male and female. Non-binary is one term people use to describe genders that don't fall into these two categories, continuing, and pansexual. This term is used to define the attraction to people of any gender or to people regardless of their gender, with the prefix pan coming from the Greek prefix for all. Mental health issues. The LGBTQ population has higher rates of poor mental health. This includes an increased rate of suicide risk, higher than the population consisting of straight, cisgender peers. LGBTQ individuals have higher rates of anxiety and depression, leading individuals to consider suicide, including suicide attempts, seriously. Individuals identifying as LGBTQ have increased mental health risks that are not due to young people's LGBTQ identities, but rather the result of the increased stress, discrimination, and violence that they experience as they navigate anti-LGBTQ bias in society. The impact of discrimination. Discrimination is a serious and detrimental and often traumatic experience that LGBTQ individuals are more likely than not to have gone through. Discrimination can lead to social isolation, followed by feelings of loneliness, disconnection, depression, and lack of motivation. This can ultimately result in trust issues in relationships. Discrimination can cause concealment. This can involve experiencing chronic stress, anxiety, hypervigilance, fear of rejection, and reduced authenticity. Discrimination can be the cause of increased substance use and eventually addiction. Resulting from feelings of depression, anxiety, and in extreme cases can lead to self-harming behaviors and sometimes even suicide. When a person is being discriminated against, they are more likely to experience family rejection and become homeless. When family members are not educated on LGBTQ issues, it can lead them to alienate the person struggling with gender identity issues. If the situation is bad enough, the LGBTQ individual may run away from home. LGBTQ and addiction. 30% of LGBTQ people suffer from addictions in some form. 18% of LGBTQ people suffer specifically from alcoholism. 20% are more likely to have a drug use disorder. 12% of the 22 million Americans residing in the U.S. who struggle with drug and alcohol addiction are LGBTQ+. 87% of LGBTQ+ people have health insurance coverage. This is only 1% lower than the straight or heterosexual individual. Statistics across the U.S. concerning LGBTQ+ and mental health. 54% of LGBTQ+ people who are residents of Oregon have the highest reported rates of affirming home environments. 52% of LGBTQ+ California residents have the highest level of people who experience depression annually. In Texas, 60% of LGBTQ+ people reported having insufficient mental health resources. Mississippi LGBTQ+ residents report the lowest at 21% of the population in the state for community acceptance. Alabama has 65% LGBTQ+ residents who have experienced discrimination, the highest in the United States. And 26% of Connecticut LGBTQ+ people reported having attempted suicide. Let's take a look at the state of California's LGBTQ+ population. 35% of LGBTQ+ young people in California seriously considered suicide in the past year, including a low 39% of the people who were transgender and non-binary youth. 11% of LGBTQ+ people in California attempted suicide in the past year, including 14% who were transgender and non-binary. 50% of LGBTQ+ Californians wanted access to mental health care, but did not receive it due to a lack of resources. 36% of LGBTQ+ CALI residents reported being bullied because of their sexual orientation or gender identity between the ages of 18 to 24. LGBTQ+ and disability. LGBTQ+ people can also live with a disability. A disability can be defined as a physical, mental, cognitive, or developmental condition that impairs, interferes with, or limits a person's ability to engage in certain tasks or actions, or participate in typical daily activities and interactions. People can have physical, intellectual, sensory, mental health-related, or other non-visible disabilities. People can have any number of combinations of these types of disabilities. People can be born with a disability or become disabled at any point in their lives. People can be diagnosed with a disability at birth, later in life, or self-diagnosed, and all are valid. LGBTQ+ and mental health matters. LGBTQ people may or may not have physical disabilities that affect the body. Spina bifida, muscular dystrophy, cerebral palsy, and spinal cord injuries are all examples of physical disabilities. These disabilities impact activities of daily life like eating, getting dressed, going to the bathroom, and more. LGBTQ+ people with physical disabilities sometimes use mobility aids like wheelchairs, canes, and crutches. Physical disabilities can be progressive. Symptoms become more severe over time, or static. They stay the same over time. Sensory disabilities can impact LGBTQ+ people. It can affect how a person perceives things. Autism, blindness, deafness, and sensory processing disorder are all examples of sensory disabilities. An LGBTQ+ person with a sensory disability can be extra sensitive to sensory input, or need to seek extra sensory input. Some people with sensory disabilities might need breaks to regulate themselves. Intellectual disabilities may affect an LGBTQ+ person's thinking. Some people call this kind of thinking neurodivergent, processing, thinking, or behaving differently than what is considered typical. Down syndrome, dyslexia, dyscalculia, ADHD, and fetal alcohol spectrum disorder are all examples of intellectual disabilities that may affect LGBTQ+ people. Like all people with disabilities, with the right support, people with intellectual disabilities can lead full and independent lives. There are those LGBTQ+ people who have mental health disabilities. Mental health disabilities are conditions that affect a person's mental health and emotions. Anxiety, depression, bipolar disorder, and PTSD are all examples of mental health disabilities. Due to the stigma surrounding mental health, LGBTQ+ people often find it hard to be taken seriously about their disability. There are 3 to 5 million LGBTQ+ people in the United States that have disabilities. Disability does not dictate gender identity or sexual orientation, so disabled people have the same range of genders and sexualities as non-disabled people do. However, many disabled people are treated like children. Even when they are adults, their sexuality and gender are often not acknowledged or believed. Parents and caregivers may even ignore a person's gender and sexuality. Staff can become an LGBTQ+ ally by recognizing the differences. Language is important to any community. In the disabled community, there are two different ways you can identify people with disabilities: person first or identity first. This goes for the LGBTQ+ population too. An example of a person-first identity in a sentence would be, a person with a disability. Putting the person first and then their disability emphasizes the person before their disability. Identity-first language. Identity-first language says that having a disability is a part of who you are and should be treated as such. Just as we don't say a person with tallness, people who use identity-first language believe we shouldn't use the phrase person with a disability, but instead a disabled person. You should always respect how people want to identify in terms of their disability. If you don't know, defaulting to person-first language is a good idea. Slurs are self-claimed. In the LGBTQ+ community, the disabled community has reclaimed slurs like cripple and spaz. Reclaiming them gives power back to the disabled community. People who do not have disabilities should not use these terms. If you hear a disabled person refer to themselves as a cripple, spaz, or other slur, you should not correct them or say it is harmful to use those words. Ableism is defined as discrimination or prejudice against individuals with disabilities. Like all forms of discrimination, there are covert and obvious types of ableism that disabled people have to deal with on a daily basis. A business that doesn't have a ramp to get into their building is an obvious example of ableism. Different forms of ableism include bullying, physical harm, lack of compliance with disability laws like the Americans with Disabilities Act, ableist microaggressions, and inappropriate behaviors, such as asking disabled people to prove their disability. There is another kind of ableism called internalized ableism. This type occurs when a disabled person accepts society's negative attitudes toward disability. Internalized ableism can manifest as depression, self-hatred, and low self-esteem. Because of how our society thinks about people with disabilities, ableism has been internalized by a lot of people. LGBTQ+ in numbers. One LGBTQ+ person every 45 seconds attempts suicide. An LGBTQ+ person is 4 times more likely to attempt suicide than their peers. 1.8 million LGBTQ+ people seriously consider suicide every year in the United States. 47% of LGBTQ+ people were unable to get the help they desired with their mental health who are living in rural areas. And 50% of LGBTQ+ people felt supported by their community who were living in rural settings. It is very important to support and give needed resources to LGBTQ+ people with disabilities, because there is not a lot of information for them, leaving them feeling very alone. LGBTQ+ people with disabilities face double discrimination because of the intersection of their identities, which can be exacerbated if they also hold other marginalized identities. It can be even harder to find support from their family and friends, which can leave them feeling very alone and increasing the risk of substance abuse and suicide. Staying open and giving resources for LGBTQ+ people to get information and learn about disabilities, substance abuse, and sexuality can be instrumental in them getting the help they need. It's pronouns and respectful communication. Pronouns matter and are a core part of a person's identity. Always make sure to use the correct terminology and correct pronoun as showing a sign of respect and affirmation. This is much like saying someone's correct name. Once you misgender someone, it causes emotional harm and could trigger past trauma, shame, or invalidation. Affirming a person's gender identity is a part of trauma-informed care. When staff is asking a new intake about their sexual orientation and gender identity, it is important to normalize these questions. Frame the questions as part of standard care, not something extra for LGBTQ+ clients. Rosie, we ask everyone the same questions to help us provide the best and most respectful care possible. Ask this with clear and simple language. What is your current gender identity? What sex were you assigned at birth? What pronouns should we use when referring to you? For information regarding sexual orientation, how do you describe your sexual orientation? Don't pressure clients to answer if they're uncomfortable. Clarify why the information is collected. This helps us tailor services and create a respectful space for everyone. Always reassure compliance with confidentiality. Your information is confidential and used only for care planning. What staff should not say or do. Here are some examples. Part of the intake process includes learning how clients identify so staff can make sure we're addressing you respectfully and meeting your needs. What name and pronouns do you use? How do you identify in terms of gender and sexual orientation if you're comfortable sharing? Remember not to ask in a judgmental or surprised tone. Don't ever say, "What are you really?" or, "But you don't look... Don't ask about gender reassignment surgeries and current genitalia status or transition unless clinically relevant and done sensitively. Follow the guiding principles when searching for a new intake that is considered transgender. Respect a person's gender identity, honor how they identify. Preserve dignity and safety, minimize humiliation or re-traumatization. Use trauma-informed care. Assume past trauma may exist. Avoid discrimination. Be consistent in protocols and adapt them for inclusivity. Never base a search protocol on a person's sex that was assigned at birth. Always ask the client how they identify and respect that. Searching based solely on sex assigned at birth is inappropriate and discriminatory. When searching, always ask the client their preference regarding their gender identity. Use clear, respectful language. We are required to conduct a safety search during intake. We want to do this as respectfully and comfortably as possible. Would you prefer a staff member who identifies as male, female, or someone else to conduct the search? Let the client choose the staff gender. This promotes trust and trauma-informed practice. Ensure same-gender search by verbal confirmation of identity. If a client identifies as a woman, offer a female staff member. If a client identifies as a man, offer a male staff member. If a client is non-binary, ask their preference. If the staff pool is limited, pause the search until an appropriate person is available. Always conduct the search privately. Use a private, same-gender area away from other clients. Have a second staff member present for accountability, never alone. Avoid unnecessary exposure. Clients should remove only what's required. Document and communicate professionally. Remember to document the client's search preferences in a confidential part of the record. All staff must use neutral language when referring to a search. Example, safety check completed by staff per client preference. As an organization, it is important to put forth that effort in creating an inclusive and affirming environment for sexual minority populations, especially in substance abuse treatment settings. To ensure we offer an inclusive program, we address this matter in our policies, environment, provide staff training, and include adjustments in treatment and clinical care. The organization has implemented policies on conducting inclusive intake and assessments for gender minority populations. During the assessment process, the following steps are in place to help provide clients with a feeling of affirmation and safety. We collect data from the point of intake concerning their sexual identity and orientation. We do this with respect and confidence in the care we provide. We incorporate the use of inclusive forms. Staff use inclusive forms with options beyond male-female. Example, include options for other or prefer to self-describe. We collect a history of client trauma. Staff conducting assessments are trained to ask about past experiences of discrimination or trauma related to sexual identity. We implement efforts to promote inclusivity in various areas of the program, including regular staff inclusivity training, affirming environment of care, such as gender signs and other inclusive visual aids. We enforce a non-discrimination protective policy and offer additional LGBTQ+ program and service resources.